Well, this morning we're joined with another special guest from Greenwood Leflore Hospital. This morning we have Dr. Douglas Bowden of the Lucas Surgical Group. Welcome, Dr. Bowden.
Thank you.
Dr. Bowden, now October is Breast Cancer Awareness Month, and how common do you guys end up seeing breast cancer just right here in Mississippi?
Right. Well, according to American Cancer Society, the incidence of breast cancer in Mississippi is 112 women per 100,000. So
wow.
That calculates out to around 1,700 cases a year.
Wow, and that just happens right here.
Right.
Let me ask this. Now, we were talking with somebody just the other day, and I'm sure we'll address this in a minute, but having family and friends, you know, you have your family, your moms, your grandmoms. When they get older, you may know, they may not know. How important is it for them to get checked? And with that, how important is the advice that comes from your family and friends? If they're worried about you and concerned about you, what do you recommend for those that are getting all this input from their family?
Right. Well, certainly if they have a family history of breast cancer, that's important to know. I think most women, what they need to do is, if they're concerned or they have a diagnosis of breast cancer, about what to do, is obviously go to a physician that participates in breast cancer treatment. And also, what I try to do with my patients, you can get information overload. And so a lot of times, everybody gets on the internet.
Right.
We try
WebMD.
Right. We try to direct them actually to the nccn.org, which is National Cancer Organization, and of experts, and they touch on all the diagnosis and treatment of cancer, especially breast cancer. So
I don't know, you know, as somebody's in those positions and they're getting all these conflicting things, having some place like that to go is important. Let me ask this: what age should women who are thinking about maybe I need it, maybe I don't? What age do you recommend them going and getting their first mammogram?
At age 40 is what we recommend.
Okay.
Of course, that would be your screening mammogram. If they have maybe a family history or a higher chance of having breast cancer, then we might do that earlier in their 30s, and might even get an MRI as well. But for mammogram screening, we usually recommend at age 40.
Now, is there, I mean, like you were saying about, you know, the family history, is there an age that's too early?
Really, mammograms don't give you much information if you're earlier than age 30. The reason is because of the density of the breast, and so it's more difficult to read.
So somewhere between that 30 and 40 range at the least, right?
Right, correct.
Right. Let me ask this: if there's folks that want more information about what you guys do or what you can do, how would they find that out?
Well, certainly they can call Greenwood Leflore Hospital or Lucas Surgical Group.
Fantastic. And the website that you told us about,
nccn.org.
And that stands for?
National Comprehensive Cancer Network.
So fantastic. So if you're wanting more information, you can check out that website. Also, if you have family and friends, be sure to get checked early, at least by age 40, correct?
That's correct.
And check out with Greenwood Leflore's Surgical Group, the Lucas Surgical Group, and Greenwood Leflore Hospital to find out more information. Stay with us. We've got more coming up after the break.
This Health Matters segment is brought to you by Greenwood Leflore Hospital.